Okay. Mr. Davidson? All right. Ladies and gentlemen, thank you for coming back. We are, as you know, we want to keep the people of South Carolina informed and up to date on what we're doing, and I've issued an executive order today that will go into effect tomorrow afternoon, and I'll get to the particulars of that in a minute. But to summarize where we are, we've done taken a lot of good steps. I have great faith in the people of South Carolina. They're doing very well. They're following instructions. They're doing what we've asked over time and time again, and we're making progress. We have about 73% of our state employees, that's over 53,000, are actually working from home. The rest, 20-something thousand, are in the regular workplace. The traffic is down on the interstates about 2/3. That is, things are slowing down. Flights coming into South Carolina are markedly down. I think at Greenville-Spartanburg, they're down about 90%, down 90%. If you look on the television or you drive around, you see the streets are relatively empty a lot of parts of the day. And people are doing what we've asked them to do, and I'm real proud. We have had some, as you know, that over the weekend, that despite our instructions and recommendations about social distance of 6 feet and crowds, no crowds congregating, there are some that I guess the sunshine got to them and the warm weather, and so we had to remind them of that, and so that's why we issued the order yesterday, closing the beaches and those islands where there was a lot of those kind of congregations going on. And they were being dispersed by law enforcement, but then they'd come right back. So anyway, we're making great progress. But today I'm issuing another executive order, which I will describe now. And you might note that whereas in some other states, what they've done is attempt to list all the essential businesses in the state, every one of them, and say that these will not be subject to closure or restriction. Those lists are so long and so confusing that we've decided to do it just the opposite and list only those, the bare minimum that we can restrict or close, the bare minimum that are places where we know the virus has a good place to grow, but also that are not essential as the others, where they have close contact and a lot of activity. So those are the ones that we're going to today, and we'll start now. We could do, where's the chaplain? Come ahead, please.
Good afternoon. Ronald Reagan had said, all great change in America begins at the dinner table. So if you would, please pray with me. Gracious Lord, while our hearts continue to grieve for those we've lost due to the virus, I pray that you comfort those families and also, Lord, bring a sense of comfort to those that are isolated and can't have human connection, even with social distancing. Help us as a people to rally around what's been asked of us to keep loved ones and strangers alike safe. May we use this extra time to find ways to reconnect with our families around dinner plates at home instead of hurried meals on the go around home plate at the baseball fields, lacrosse fields, soccer fields, and various activities that occupy our time. I pray we're able to embrace the moment of this pause to reassess priorities, find peace and simplicity, and restore our connectedness around the dinner table. Amen.
Thank you, Chaplain. This is to summarize, these are actions that we've taken since March the 2nd. And as I said before, these have had the anticipated impact, but we know from reports that the virus is still spreading, still growing, and we must do everything we can to stop the spread, be as aggressive as we can be, using the facts, the science, and the data, and the knowledge and recommendation of the experts in the field. But at the same time, not going too far and destroying businesses and jobs that people are depending on. So we're working hard, and since March the 2nd, I've had the law enforcement authorized to disperse groups that are endangering public health. We've required self-quarantine of individuals entering South Carolina from high-risk areas. We've closed public access to the beaches, rivers, lakes, and other waterways, and taken other steps as well. This new order is effective on April the 1st. That is tomorrow, and these are the elements of that. These are non-essential, close contact business and venues where the businesses and the activities are being suspended. Again, this was the bare minimum that we think we can do in closures in order to have the largest impact, and that's the approach that we're taking. So, entertainment venues, there are three categories. Entertainment venues that are temporarily closed effective April the 1st are as follows: nightclubs, bowling alleys, arcades, concert venues, theaters, auditoriums, and performing arts centers, and tourist attractions. On the screen there. Racetracks, indoor children's play areas, but that does not include daycare. We want the daycares to stay open if they can. It includes bingo halls, venues operated by social clubs such as Rotary clubs, VFW, and those kind of things, and also adult entertainment venues. Athletic facilities and activities temporarily closed, effective also April the 1st, are as follows: sports requiring interaction with another person of closer than 6 feet, activities requiring shared equipment, activities on commercial or public playground equipment, and here are the close contact service providers temporarily closed effective April the 1st. Barbershops, hair salons, waxing salons, threading salons, nail salons, and spas. Also body art facilities and tattoo services, tanning salons, massage therapy establishment, and massage services. We have created a group that will be at the Department of Commerce, and it will be for verification and classification of these various businesses that we're referring to. And you can see on the screen there how to get to them with email. And our goal is to have a determination, a decision and verification made within 24 hours. And while that determination is being made, that is, if a business calls in and wants to know if they are included in this or not, they should continue with normal operations until they are so informed. With that, Dr. Bell.
Thank you, Governor, and good afternoon. As of today, South Carolina has confirmed cases of COVID-19 in 42 counties. This includes 158 additional cases across our state. Please refer to our website for cases by county, and that's being updated daily. We are at a point at which we receive solemn reminders daily of how serious this disease is. It has challenged us as individuals and as a state, and it has taken the lives of our neighbors and loved ones. Our response to this public health threat expands beyond institutions, beyond the frontline staff at our hospitals and healthcare facilities, and into the homes of every South Carolinian. Thus, it is incumbent upon all of us to take action to stop the spread of this disease. Last week, we reported on the shortage of chemicals needed to perform testing for COVID-19 nationwide and within South Carolina, including at our DHEC Public Health Laboratory. DHEC's laboratory has now the necessary reagents as of yesterday and has resumed a turnaround time of 24 to 48 hours once specimens are received in the lab. Additionally, we continue to work with healthcare providers to stay updated on the availability of hospital beds throughout our state. As of earlier today, Hospital beds were reported at approximately 54% of capacity. To date, we have reported confirmed cases of 1,083 reports from our public health laboratory and private laboratories. A great deal of attention is being paid to case counts, and we remind everyone that these are not simply numbers, these are people. In some way or another, the spread of COVID-19 is going to affect each and every one of us. We're all in this together, and with your help, our hope is to minimize the risk for everyone, but we have to focus on those who are at highest risk of exposure or complications and assure that we put all measures in place to protect them. The desire for some to obtain details about where infected people are located has become a disturbing distraction because it suggests that there are still people who don't understand the potential threat for everyone and that any one of us can be exposed at any one time, and therefore the need for all of us to take precautions regardless of the knowledge of where a specific case may or may not be. We're continuing to learn more about how this new virus is being transmitted and how long it can be transmitted. Some information gives us hope. For example, the CDC is reporting some evidence that community interventions are beginning to have an effect in some locations. There is also worrisome news that reminds us why these community interventions must be continued and possibly strengthened. There's growing evidence of possible transmission from infected persons before they have symptoms, and there's evidence of longer than expected spread after individuals become ill. Public health recommendations are being updated based on evolving findings. This emphasizes why details about the location of diagnosed cases is of little benefit to our goal of protecting the population as a whole, and it can in fact be harmful if people are relying on that information to make decisions about what measures should be taken. From the perspective of public health and protecting the public health, we are focusing on reducing transmission through social distancing of people in all potentially affected areas. We won't be able to stop all of these infections. At some point, the majority of us will likely be exposed, but we can reduce deaths by assuring that healthcare workers and healthcare facilities can continue to provide excellent care for those who need it most. We encourage South Carolinians to focus guidance from our public health professionals and to, whenever possible, stay home and limit close contact with others. This is a challenging time, and it will not end soon. And we're calling on everyone across our state to do things that are not easy. Here in South Carolina and across the country, we are now faced with making very difficult decisions about the most effective measures we can take to save lives. Among our many priorities, two are of particular focus at this time. The first is protecting those at highest risk of complications from infection. That will reduce hospitalizations and will save lives. The second priority is protecting those at highest risk of ongoing exposure. Our healthcare facilities must be prepared to provide intensive care, and healthcare workers must be protected so that they are available to provide patient care. Yet still, we need to continue to protect everyone. We faced adversity before, and I'm confident that together we can meet this challenge. Fighting this disease will require all of us continuing to work together collectively to achieve the best outcome for all possible. If we don't do this, if we don't follow the guidance for social distancing and staying home, then we will see higher rates similar to what's been found in other states. So we must all do our parts to protect one another. Thank you.
Thank you.
Thank you, Governor. This afternoon, we announced a guidance plan for students. We've had many calls about how we're going to handle graduation, the grading of the materials that children are working on. And so we released that guidance today to our superintendents and to the public, and I hope it's giving some level of comfort and will encourage our students that they do need to work very hard. The work that they've been asked to do will be graded, and we will be putting all of that together in a semester grade rather than two separate third, fourth, ninth weeks grades. And for seniors, we need to have all of your work completed by May 15th, and those grades will be put into our Power School system so that we can print diplomas and have you graduated so that you can go on with your life as you move into college or into a career. I had a great conversation this morning with the District Teachers of the Year, and they admitted that first, when this all was announced, they really felt overwhelmed, but it was so encouraging to hear them talk about what they've learned, how impressed they are with the work that students are doing, how parents are helping them, and all of us are calming down and really enjoying this procedure of being homeschooled with the public schools supporting their students. So I was very encouraged by that. I say to parents again, enjoy this time. There's a lot that your students can learn just by you doing special things with them. It's the old 4-H motto of learn by doing. But we want you, we're in a partnership. We want you to assist your students as best you can so that they can get their work in. And I would like to say to seniors, I am so sorry. I'm so sorry that you're missing out on some things that we remember as lifetime events, proms and ceremonies, award days, and just having time with your senior friends. But you're going to be very strong, and you'll make it through this, and you'll look back on this as something that made you an even stronger individual. But I encourage you to get your work done, to work with your guidance counselors. Tomorrow, April 1st, we will be opening registration at our virtual school that the Department of Education runs, virtualsc.org, virtualsc.org. A number of courses will be available. We think they are the most popular courses that students would be taking in this final 4 weeks, like economics for one. And we'll also have an unlimited licensure for what we call credit recovery. And that's for any student who needs a little extra help to be sure that you pass those courses that you need for graduation. Seniors will have first priority, and then it will be opened up to other students as well. That registration opens tomorrow. The classes will begin on April the 6th. So if you need assistance with that, you can go on the website of the Department of Education. Governor, I'll report to you that learning is still going on in South Carolina. We're feeding over this time frame that we've been out of school. We have fed over 1,200,000 meals. It's been extraordinary what our school folks have put together and how they're supporting not only the health needs of our students, but their learning as well. So we really appreciate all the good work and encourage our students to take advantage of this opportunity and do the best that you can. Thank you.
Thank you, Superintendent Spearman. Are there any questions? That's the lady here.
Dr. Bell, a lot of people are confusing allergy symptoms with the coronavirus and maybe flooding healthcare systems. What's your response to that?
We are encouraging people who are not seriously ill to sort of think twice about seeking medical care if it can wait. And we understand with the pollen and, there are a lot of people who suffer very severe allergy symptoms. They encourage them to use over-the-counter medicines. If they don't have severe symptoms associated with the symptoms that they typically experience with allergies, particularly a fever or a cough, that we want people to decompress the healthcare system as much as possible.
Next question.
Do we have a better idea of when the peak might be, or a new update on the May 2nd numbers? A lot of people are wondering how long they may have to be in their homes with various stay-at-home orders.
Not specifically, because we really are, from our projections within the state, are just several weeks, many weeks into it, but that's a relatively small experience on which to base long-term projections. And so there's a lot more to be learned about how these social distancing measures that are being recommended might flatten that curve or change the expected peak. And we continue to rely on more and more modeling that's being done by the CDC to help us make projections. Those, again, are at the national level and not necessarily for South Carolina. So we just have to continue with our social distancing measures with the knowledge that those will ultimately change the peak, but we can't make any predictions in any way about a particular date when we might expect that to occur.
Governor, how long will these businesses stay closed?
Ma'am?
How long will your executive order?
Well, it runs for 15 days by state statute, and it will go that long. We can change anything in there if the conditions change prior to that. But that's the tenure of an executive, of a declaration by the statute, 15 days. Next question.
Governor, you said you want.
Right back in the back.
Yeah, Dr. Bell, you said at some point a majority of us will likely be exposed, but you also said the desire to obtain details about where people are located with as tested positive for COVID-19, I assume is what you meant, has become a disturbing distraction. Why would that not be relevant information to try to prevent the spread of COVID-19, to have more detailed information, and especially with healthcare workers that potentially be exposed? Why wouldn't that be relevant?
Because it ends up being false information, if people rely on knowing about a specific address or a specific location, if they're trying to use that information about making decisions about how to protect themselves. We got disturbing information from social media that people were reporting that I'm in a safe neighborhood, no reports here, that kind of thing. And I can't help but ask the question, does that mean that they're going to modify their behavior in some way because they believe they're in a safe community? Very early on, the CDC predicted that the majority of us, either in this season or in the following year, will ultimately be exposed. So if people are trying to use very specific information about making decisions that their community is safe and that they should not observe the recommendations, then it becomes harmful information and it creates a false sense of security.
What about the reverse of positive tests? Because you're talking about the negative part of it, like, oh, my community's fine, no one in my neighborhood has it. What about the reverse?
What do you
People
mean by the
testing
reverse?
positive. I know you have the zip codes put out, but say certain buildings or facilities, whether it's healthcare professional workers, we saw MUSC had 34 employees that tested positive for COVID-19. That just came out, but there could be others within the community, other healthcare facilities that have tested positive, but we don't know if anyone in that facility has.
So that's why we focus on the close contacts of known cases to take more measures for isolation and quarantine of the contacts of known cases in high-risk settings, like healthcare facilities or congregate settings. If your question, if I understand you, about what does the public know? So for example, in a grocery store or something like that,
Yeah.
because the measures are the same, we don't consider everyone who's been in a large public gathering to be exposed, and that's why we recommend the community measures. The other thing that we need to point out, though, is as we learn more information about people potentially being able to spread when they don't have symptoms, and the reliance on diagnosed cases and where those reported cases are, it ends up having people miss the picture that there are unrecognized cases everywhere. And therefore, they have to practice those measures regardless of what they know about a specific case at a particular point in time. Spread is ongoing, and we all have to take precautions to protect ourselves, no matter what we know about an individual case. It ends up being misinformation.
This gentleman, yes, sir.
You said you want daycares to stay open if they can, but you've already closed schools, and daycares tend to follow schools' lead. I mean, why keep daycares open?
Because there's a great demand. People need daycare centers, and they depend on them, and they can't work without them. So we'd like those to stay open within the kind of limits that have been pronounced by the health authorities, the CDC and others. Like people need daycare centers. Yes, ma'am.
Governor, people are reporting coronavirus scams online, asking for their address and money. How can people distinguish what is a scam and what is not?
Well, I'd say listen to law enforcement. Don't trust anybody that calls you up on the telephone or emails you with that kind of information. Rely on the website. We have virtually every state agency has a website that has coronavirus information on it. Go to that. You can depend on that. They're updated. They're highly professional. They're easy to use, and most of them refer to the others. That's the way to find your way around. just like always, that there are people out there, unscrupulous people, that will try to take advantage of the situation, and this is one of them. And to the extent that we can catch them, I'm assure you that they will understand that they have broken the law. And the Attorney General, by the way, I think has over 500 complaints or so of price gouging, and those cases are being addressed or investigated at this time. Ms. Adcox.
Please talk about the timing of this order and why you didn't do it sooner, and if you have any idea how many of these businesses are still open.
Well, a lot of these businesses probably are not open. We know a lot of gymnasiums have closed up. A lot of businesses that have taken it upon themselves to go ahead and close for a number of reasons, one of which is they don't want to be a source of spreading the virus or a location for spreading the virus, and another is there are no customers coming to see them, so it's financially wise to close down. But the timing of this is our hope from the beginning, and the procedure that we established, the structure that we've been following, is to do the things we need to do, the best things to do based on the science, the facts, the recommendations and advice of the experts in the field and the data. And it has been mentioned that the CDC has said that it appears, if I understand it correctly, that one can have the virus and not show symptoms for up to 48 hours and still be able to transmit that virus. That's a little bit of a movement of the bar there by the CDC. But also we've had, as I mentioned earlier, we've had a lot of great cooperation all over the state, but in some places there has been a lack of understanding of the seriousness of this, and that's why we're having to move forward. But also these businesses that we have and activities that we have focused on here are those that have high contact sometimes in very, very close quarters, but that are not as essential as other businesses to keep the economy going, although it's essential for the business. We know that, and that's one of the regrettable things about this, is that there's going to be some dislocation as we go along. We're hopeful that the federal authorities and what you've heard the president and others announcing are going to provide some financial assistance in those areas, but these particular ones, I think we probably have a smaller list. We've whittled it down to where we thought we could get the biggest impact with the least disruption. We know it's disruption for a lot of people, but we think that in our approach, which is to maximize our efforts aggressively against the disease while attempting to avoid all but necessary dislocations, is the right path to follow.
Governor,
Yes, sir.
So are you basically telling people to stay home if they don't need to go out?
We've been saying that from the very beginning, is stay home. We had it on 77 of the electronic signs on the highways. I think everything we've had, we said stay home. And a lot of people are staying home, and that's good, because there's a lot of people don't get to stay home sometimes. But we've been, the things that we have been asking people to do are the things that the experts, the data, the science, and the knowledge of the experts and experience have shown work. And if people will do those things, then we'll get through this better than we will if they don't, because this is a dangerous disease.
To follow up, just for these essential businesses that are still open, do you have any advice for them? It sounds like some places aren't doing the best to keep safety measures in place for people that are going there. Is there any advice that they should be doing? Safety measures, should they be sanitizing more? What should they be doing?
Every business should be following the recommendations and advice that have been explained time and time again here, from social distancing to keeping things clean. We asked the businesses to open early for some of the seniors to avoid the crowds, and the seniors are taking that advantage of that and actually flooding in. But all of these things that we've been urging from the beginning, there's some things that you can't make somebody do. You can recommend, but I think as the virus is spreading, and we've seen dramatic scenes in other parts of the country, we don't want that to happen here. And we have people that understand, they are good neighbors, they're smart, they're disciplined, and if everyone will follow these rules, and I've got confidence in the people of this state, if everyone will follow these rules and these suggestions, as Dr. Bell and others have pronounced, we'll come out of this much better than if we don't. But it's not over yet, and it's gonna get worse before it gets better. Yes, ma'am,
So in
Ms.
your
Adcock.
estimation, does this differ any from the stay-at-home orders that cities and other localities are doing, and if so, how?
We are not ordering people to stay at home, but from the very beginning, we've been telling people to stay at home, recommending it. Everyone just about that's spoken here has said that. But, and a lot of people are staying home. Yes, sir.
So you keep saying that you're trying to do maximum efforts with minimum damage, it sounds like, from
That's
an
right.
from an economical standpoint.
But some damage is
Unavoidable.
unfortunately necessary.
No, I understand that. So, but you keep saying you're only suggesting right now to stay at home. Why not just issue the mandate or shelter in place? As we've seen,
'Cause
people
that's-
not listening
that
completely.
is-
You look at the beaches and
No,
other areas.
that's what most people are already doing. The spots that needed special attention were the beaches and these other areas that we're talking about now that we've addressed in this order. Yes, sir.
So, we're learning more and more about this disease. Is there any worry that people who prepare our food, restaurants, takeout places, is there any guidance for them, like, can they spread this, the disease without showing symptoms? And why not close restaurants if that may be the case?
Dr. Bell?
Well, we're still focusing on, I guess, the maximum benefit with the minimum disruption. And there is the chance of asymptomatic transmission, but if we're looking at a restaurant worker and there are restrictions in people getting food service in a facility, if there's curb service, and we've reduced the risk of face-to-face contact and things like that, then we're continuing to take measures to reduce the probability of exposure. We can never bring that to zero, and we can't do 100% isolation. So we focus on the efforts that are the highest yield in preventing people from being exposed, and focus on protecting those who are at highest risk of having complications. And we focus on those who are expected to have ongoing face-to-face exposure with people who are sick, as opposed to a restaurant worker. It's a difficult balance because we still say that the majority of the people in the population overall are well. There's a random chance that anyone at any time can be exposed. And so you have to balance that as much as you can, limit the possibility of exposure to protect everyone, while also trying to protect those at highest risk for ongoing exposure and the most serious complications.
While you're up there, Dr. Bell, is DHEC tracking the number of hospital employees across the state who may have tested positive?
Not in a specific occupational category. So healthcare facilities are aware of their healthcare workers who are positive, and they are monitoring those and allowing those to come back to work as appropriate when their symptoms have resolved or depending on their healthcare needs. But DHEC is not monitoring hospital workers any more than we would in any other occupation as to the number who are currently ill.
Is there any special guidance you're giving to hospitals if they have an employee? And what type of guidance are they getting?
It's information that's posted on the CDC website. We've provided them guidance about how they should how they should monitor employees who are not ill, monitoring those entering a facility, and how they can make decisions about return to work for those who have been diagnosed. And so that guidance has been disseminated in our health alerts, and we're in direct communication with healthcare facilities regularly to provide that guidance. And we consult with them on a case-by-case basis.
In the back.
I spoke with a couple of state district representatives today, and they've been monitoring the executive orders that have been put into place, Governor, and one told me that it's almost a piecemeal as we go data by data. As you said, you wait for the scientific data to come in before you issue an executive order. What data are you waiting for before maybe issuing a mandate for stay-at-home or a shelter in place?
Listen, at this point, whether it's an order to stay at home, a recommendation to stay at home, a suggestion to stay at home, whether it's written, whether it's oral, if there's anybody out there that does not know that they should stay at home, then we've really been missing something. People should stay at home as much as possible. They're going to need to go to work. The things that they must do, but other than that, they need to stay at home. Yes, ma'am.
I hope I'm not reiterating my colleague too much, but you said this executive order will continue for 15 days. If it continues to get worse, is there a plan in place for that? Will you close more businesses after that?
We will take these situations as they come. When I issued the first emergency declaration, we knew there may be a second because of what has been described by the science, by the data, by the experts as the course of this event and when it would peak and so forth. It is likely we may have to do another one, but that depends on the circumstances, the facts, the science, and the data when we get to that point. Also, things change in between. As I say, the CDV view of things has changed and has evolved with this new disease. There are new factors coming in all the time. But what we have a steady plan to see to it that we're going to be prepared for the people of South Carolina. Right now, we're as prepared as any state, maybe more prepared in getting our hospital beds and those sorts of things available. We've been working as a part of our plan to see that that is done, and the National Guard and the FEMA and the hospitals and all are working together on a plan, and it is being implemented now. Yes, ma'am.
I have a question actually for Dr. Bell. Are we getting numbers from our military installations, and are we including those in the state numbers? Are they included in the county numbers?
I'm actually not sure about, so you mean diagnoses made on military facilities in
Correct.
Fort Jackson? I can't answer that right now, but we can get back with you. There are reportable conditions within the state, and all providers and laboratories are required to report these cases to DHEC.
Dr. Bell, can you elaborate on the 22 deaths we've seen so far? A lot of them primarily have been elderly and with underlying conditions, but I think you guys just reported the first death of a middle-aged person today. Can you elaborate what we've been seeing as far as people who have died because of COVID-19?
The picture that we've seen in deaths in this state follows the expected pattern that the majority are in older individuals with other underlying medical conditions, but we also know that younger people who also have underlying medical conditions can be more severely affected, and that in fact anyone in any age group can unfortunately can die.
Dr. Bell, there's a lot of conversation about the mask and people in the general public wearing masks to protect themselves. Can you elaborate on that? Is there a need?
No, that's not recommended for people in the general public to wear masks for several reasons. The first is what I've alluded to, that at any one point in time, the majority of people in the population in general are actually well. There will always be sporadic cases of people who are ill, and so that's why we do social distancing. And the other most important feature or fact is that that personal protective equipment is in very, very short supply. And so if the general public begin using masks, that depletes the supply for healthcare providers who every single day in all that they do are expected to have direct face-to-face contact with people who are sick. And so therefore they are at the highest risk of exposure, and the general public should not be depleting those supplies for the possibility of some random exposure. They should practice social distancing.
Can you give some specific directions to funeral homes and what is acceptable when having funerals for family members and just guidelines for the funeral practitioners?
The CDC also has guidance for funerals and for funeral directors, and they work with families on an individual basis to make these very difficult decisions about having family gatherings during a life-changing event. And so that information is available from the CDC, and DHEC has provided that to funeral parlors.
Governor or Dr. Bell, because there are more than 30 cases at MUSC, do you think hospital workers are being protected enough?
Well, there's a serious concern about the availability of personal protective equipment to satisfy the expectations of healthcare workers. And we're continuing to work at all levels, with the federal level, our Strategic National Stockpile, with the Hospital Association, and others to supply that demand.
Is DHEC trying to buy PPE on its own?
Hi, Nick Davidson, the Acting Director of Public Health for DHEC. Indeed, as Dr. Bell and others have said, we're first working and have been actively working with the Strategic National Stockpile, which is that federal resource. We expect another shipment in. We received some yesterday, a part of that shipment, and the rest as the week goes along. And we expect to begin distribution of some of that materials with our partners here at Emergency Management and our partners in the Guard as well. We are using state funds to begin to purchase those as they become available. Some of those supplies, as many have said, have been hard to come by, but we do have state funds that we're very appreciative to the legislature and the governor for, that will allow us to purchase some of those supplies as they become available. So absolutely, and we'll be distributing those in probably a similar manner as we have done the Strategic National Stockpile supplies.
Are you bidding against other states?
I'm sorry?
Are you bidding against other states for these materials?
No, it's not an active bidding process, but certainly it is a supply and demand issue. So yes, it's a challenge for everybody at this point in time to get many private supplies, but we're working actively to do so.
Dr. Bell, for those at home, you mentioned underlying conditions, and I know we've spoken about it time and time again. So the first part is, can you describe to people at home what type of underlying conditions are we talking about that may make someone more susceptible to being infected with COVID-19, and also how confident are you right now in the system, the measures in place for testing? I know I spoke with a woman from Camden who's on day 9 waiting for her results to come in.
Yes, and these are conditions, it does not make people more susceptible to being infected. It makes them more susceptible to having severe complications if they get infected. And those conditions are chronic lung disease, heart disease, diabetes, any condition that weakens the immune system, and diabetes, and that is in any age group. And then the question about getting test results.
Just where's your confidence right now, just within the state, of being able to get the specimens in and turn them around? I just know there's a woman from Camden who's been just contacting me. She's on day 9 waiting for her test results. That might be an anomaly in the state. I'm just curious what your confidence level is right now with getting test results back once the specimen is received.
And we're not specifically seeking to test people with underlying conditions, but if a decision has been made to test someone, we do recognize that there is a delay in getting test results back once a decision has been made to test. I reported that the public health laboratory has now gone back to being able to turn around tests within 24 to 48 hours, but some private labs, I understand, are still having a backlog, and there is a delay in getting those test results back. And that's another reason why we are looking to prioritize who gets tested, so that we can make sure that testing is done for those in hospitals, so that if they're negative, they can be moved out of isolation if that's not necessary. And that's a way that hospitals can preserve personal protective equipment.
Governor?
Yes.
Does your order supersede the local orders already on the books?
Yes.
Does it prevent other municipalities from passing orders too?
Yes, that is the law. It has been the law. Yes.
It does prevent other municipalities from
Yes,
passing? Okay.
that is the law. That's not based on the executive order. That is the law of South Carolina. Ms. Adcox.
Well, on that note, does that mean, what does that mean for stay-at-home orders by Mount Pleasant, Charleston, Columbia, in your estimation?
I think that again, as we mentioned earlier, staying at home is a very smart practice. And that's what everyone should be doing, as we've said since the very beginning. Staying at home is a good thing to do. It's wise.
Do we have any concrete figures yet for what South Carolina will get from the federal government, and whether our rural hospitals that need help, especially now,
We
might
do
get
not.
some?
We're expecting, we know it's a lot of money. I think it adds up to something like $1.95 billion. But the regulations and such have not been promulgated yet in Washington to determine how that is to be disseminated. But we know it's coming here, and we're ready for it. We're also, the same thing is true with the unemployment money, funds or support coming from the federal government. We're awaiting a lot of that as well.
How fast might it come, do we know?
I think the Director Elsie at the Department of Workforce said they're looking for some information this Thursday. But for the others, or the other funds, I don't know. But we'll have to verify when it's going to get here, but I'm not sure that the people writing the regulations know yet when it's going to get here. But we hope soon.
For Dr. Bell, just a couple questions again. I know you wanted to discourage the misinformation, but I'm curious just for first responders, let's say, so not for public use, but for first responders, are they more aware of specific locations where there might be a hotspot, say, for COVID-19, so they know exactly what type of equipment they should be using when they approach people, protective equipment? Or is that just standard practice anyways at this point for first responders to treat everyone as if they might have, COVID-19 so they can protect themselves from being infected? And then the other question was, do we have data within the state of how many people have underlying health conditions?
So to address your first question, we are setting up a system through a secure database to provide to EMS dispatchers information that they need to make decisions about response. And to your second question, I do not have general information about the number of people in South Carolina with underlying health problems in different categories.
Dr. Bell, I just want to make sure I understood you correctly. Does DHEC have a count of how many healthcare workers have been infected or tested positive for COVID-19?
No.
No. And go ahead.
Yes, ma'am.
Thank you. I'm from Greenville, and I know they're considering putting in orders in the city for like 6 feet between people in grocery stores and home improvement stores. So I know you sort of addressed this earlier, but can you directly address sort of what you would tell, city officials in Greenville or the people of Greenville who are considering further restrictions? Literally today they were going to have a meeting on it. So. Well,
I know that those the social distancing and all of those have been the recommendations and the understandings from the very beginning. I think that we should do all to be sure that we should do all we can to be sure that everyone knows that. But the things that are covered in this executive order, of course, are mandatory, and we think that they will have the desired effect with doing the least disruption, the biggest impact with doing the least, although there is going to be some disruption, but there are a lot of things that the towns and the municipalities can do in that area and to try to spread the knowledge and information and recommendations, and they're within their limits to make certain ordinances. Yes, sir.
Governor, what's just your message to the people of our state who might be scared right now as they see the numbers increase?
I'd say have faith. South Carolina has been through everything since I began in 1670. We've been through every war, just about hurricanes, tornadoes, earthquakes. We've had it all, and we're still here. And right now, as we stand here, until the coronavirus took over the national debate, the debate was one of economics, and South Carolina is thriving. Now, this is going to be a suspension of that thriving, but we're going to get through it. And the way we'll do it is by following the rules, having common sense, being a good neighbor, and doing everything you can to try to find the bright side. We all going to come out of it. Our economy is going to continue. It's going to take a dip, no doubt about that. But we're doing all we can in this office and the others that you've heard from to see that the least damage is done, permanent damage to businesses and jobs in South Carolina. The least is done, but we got to have the biggest possible impact, and that is reflected in the measures that we've taken that are based, again, on data, science, the experience, knowledge, and advice of the experts in the field. Yes, ma'am.
You repeatedly said now our people follow rules, but obviously they didn't at the beach this last weekend. Do you have any numbers of how many fines, how many tickets have been written, even just for state law enforcement?
We'd have to verify that. I know Chief Keel has cited various numbers at times, but he would have that information. I'd have to verify that for you. Yes, sir.
Follow up on the beaches. There are people who have private access to beaches, and can they just let all their friends through?
I
to
think
enjoy the beaches.
that is not what these executive orders and rules contemplate. And if someone is abusing that privilege, then although the public access, as you know, is closed, if someone is abusing that, then there's yet another law, and that's one that's been in effect, like the price gouging law, for a long time, and that is law enforcement can cite and disperse crowds of virtually any size down to 3 people that are posing a danger to the public health. And that is what we've implemented by this declaration of emergency. Yes, ma'am. One more. Yes, ma'am.
To Dr. Bell, again, back to Fort Jackson, for military security reasons, they're not telling people about those reported cases. Does that put the people in Fort Jackson at risk?
So I did not say that they weren't reporting. I said that by law, all providers in South Carolina and labs are required to report. I didn't have specific information about military installations.
I do have a question from a teen journalist for Molly Spearman, if that's okay, that just came to me.
Yes, sir.
She asks, in case, let's see, if DHEC is expecting 8,000 additional cases by May 1st, do they expect to close schools for longer? And if so, sorry, someone's calling me in the middle of that. If so, why not make that announcement now so the plans for end of year can begin to be drafted? That's from a teen journalist.
Thank you. It's a great question, and we hear that question often. As the governor has said, we take this in steps. I'm praying for a miracle. Maybe a miracle will happen, and we will not have to close schools any longer, but certainly at the end of April, mid-April, we'll look at the situation and make the appropriate decision then.
We thank you for coming, and we'll keep you informed.